Welcome to iSpa Talk, where we educate, empower, and encourage women to practice safe beauty habits, starting with their eyes and skin. I help you connect the dots between beauty and science. Some say your eyes and skin say more about you before you open your mouth. My name is Dr. Janelle O.D. I'm your host and the CEO and founder of Brilliant Eyes Vision Center and Premier Dry Eye Spa. Thank you for tuning in. Let's chat.
Hello, everybody. Happy Sunday. It's Dr. Janelle O.D., your eye care expert. I have a special guest with us today, but we're going to get to Dr. Perryman in a moment. The dry eye master herself is here with us today. I'm so excited. Thank you for tuning in. We were supposed to be here last week. We had some technical difficulties, but we're here and ready today. We have our Christmas trees in the background. We have some bubbly because I realized this is my last show in 2020. Oh, my goodness. And so we're going to have a little toast at the end. But we're going to jump right in. For those of you who don't know, my name is Dr. Janelle O.D. I am the CEO and founder of Brilliant Eyes Vision Center and Premier Eye Spa. I specialize in dry eye and ocular aesthetics, and I help you connect the dots between beauty and science. So we meet here about 3 times a month on Sunday evenings, and I help bring in industry leaders in both optometry, ophthalmology, dermatology, aesthetics, cosmetology. We have a host of people who are on here to help you connect the dots between beauty and science. But before we get in, I'm so excited. I want to show you here around town. All right. So those of you who are local in the Georgia area, in Smyrna, Kennesaw, Austell, pick up your magazine and turn to page 32. I am in there. I'm so excited. Yay! And it's my first editorial. So all things dry eye, of course. And the topic is, before I get into dry eye, I talk about becoming a Georgia peach. I'm originally from Michigan. And so read the article to learn about my journey to Georgia and how I'm in the process of becoming a Georgia peach. And you'll pick up some tips on how to maintain and manage your dry eye symptoms. Okay, so we're here to learn. I'll get my pencil and paper ready because we have the dry eye master herself here today, and she's going to help us get our eyes all together. So we're going to jump in. So Dr. Perryman, please tell us who you are, where you are, and how you started calling yourself the dry eye master.
Oh, thank you so much, Dr. Janelle. It's super cool to be here. And I loved listening to your intro and listening to your, I think maybe we were separated at birth because I'm so passionate about eye health and beauty and the science of beauty and the science of eye health. It's so cool that we share that common passion of how to have our eyes be as beautiful and healthy as they possibly can be. And those two are not mutually exclusive. They go hand in hand, and we can be mindful in how we approach this and provide this for our patients. So I'm Laura Perryman from Seattle, Washington. I grew up in the wilds of Montana. I'm the granddaughter of cattle ranchers. And I'm one quarter Norwegian, but my husband swears it's 100% because he says I'm kind of stubborn. But that aside, I came to the West Coast for college, got myself through college, met my husband 6 weeks before he graduated. I was a college sophomore, and it was just enough time to fall in love. So he came up to Seattle, where he's from. He's actual Seattle native. There's not very many of those. Most of us are transplants. And he started law school. So we did the long distance thing for a year and a half. And I graduated college early and moved up here, not without a ring on my finger, but
yes,
proposed
put a ring on it. Put a ring on it.
Right. I moved up and worked in biotechnology, doing molecular immunobiology, which is a mouthful, but so wicked cool, sciencey, nerdy fun. That's where my passion for inflammation and dry eye and science really took root. Technical difficulties.
I know.
I'm gonna just keep going.
Keep going. I'm gonna take my camera off.
It happens. That's how you know it's a live show. So yeah, after Rick and I got married, I worked there for a couple years and got to help work on Enbrel, which is one of the first biologics for autoimmune disease. Got him through law school, then I got to go back to school, and that was, I always wanted to be a doctor. I knew at the age of 12 I was supposed to be a doctor. So I got to go back and fell in love with ophthalmology. I don't have to explain that to the eye people in the crowd. Eyes are so poetic and beautiful and magical. And I remember when I was a fourth year med student, I had this eye rotation and my poor preceptor was so busy and I was just trying to be helpful and stay out of the way and learn a little something. And she didn't even have time to eat lunch. She's like, hey, do you want to come in and see this YAG capsulotomy? I'm like, sure. And there was an observer scope on the slit lamp.
Slit lamp, yeah.
And I'm watching this YAG capsulotomy go bing, bing, bing. And this cloudy membrane floated away like Ginger Rogers' ruffled gown and restored this clear visual access. And I swear to God, there was like harps and parting clouds and sunbeams and the whole thing. I'm like, I have to do this for the rest of my life. So I fell in love with ophthalmology and then did a cornea and refractive fellowship afterward. And my fellowship director was heavy into cytokines and wound healing. I'm looking over his shoulder one day. I'm like, oh, that's really interesting about TNF. And did you look at IL-1 and all this stuff? So he looks at me like, how do you know all this stuff? I'm like, well, I did that before med school. So yeah. I had a wonderful fellowship here and it reignited my passion for inflammation. Well, it turns out you can address inflammation in some ways that involve your everyday habits and your everyday chemical exposures. And we're going to deep dive into that. But you did ask me one more question that I haven't answered yet. How did I get the name the Dry Eye Master? So my darling, amazing technician, this was, 8 years ago, hardworking woman from Minnesota. She's a lovely human. She said to me one day, she's like, Dr. P, you're the Dry Eye Master. I'm like, oh, I don't know. She's like, I think we need to make an Instagram account for you. I'm like, oh, I don't know. Cause I'm kind of, I don't like being braggadocious, right? Mm-hmm. So I fought it. And finally she said, she came to work one day and she's like, I already created the account for you. Here's the key. She wasn't going to let me not do it. And it's been a lot of fun. It just, to me, it means not forever learning and being a humble student and being generous with what I know and learning as a community is what Dry Eye Master means to me. It's not that I'm so much better. I don't think that at all. I just think that the mindset is constant growth, constant exploration, community, like reaching out to our fellow colleagues and just sharing information. That's what Dry Eye Master means to me.
And I definitely say you live up to what you believe that what your mission is with Dry Eye Master, because like I said, I watch your lectures. I'm in some of the same Facebook groups that you're in, and you're very giving with the knowledge that you have. You're very approachable. Like I watched your lectures that you did about the DAO, which you're going to talk about, and I was like, this is amazing. You know how all these things connect, but you put those things together so beautifully in your lecture. And so I was on Instagram and I started following you, and I'm like, okay, I'm just gonna send her a message. And I was like, she's got to be cool because she plays music from the 80s in her lectures. And anybody that does that, it's got to be cool. And so I sent you a message and I was like, she responded. And I was like, oh my gosh, she's so nice. Because some people who are, in your position, they're not as approachable and not as giving with the knowledge. And I think that's important because that helps the outcomes better for all patients across the country when we can learn from each other and take your expertise and help apply those things to our practice, especially ODs who are trying, or ophthalmologists who really want to get into that space of dry eye and ocular aesthetics. Like I said, you practice what you preach, and I definitely appreciate that. So all the optometrists out there, MDs that are listening, ophthalmologists, she is the truth, meaning she's a master and she has no problem with sharing her knowledge. So we're here to learn. So let's get more knowledge, let's get as much as we can out of the time that we're here. So in your professional opinion, why do you feel dry eyes is on a rise? Why is it now the thing,
Yes. Oh, that's such a rich question. I think it's really complicated. Unfortunately, it's not linear at all. And because of that, it just requires a different approach in your risk assessment for each patient and your understanding of the disease state, of what fuels and fires it. It's, you think about pioneers. So, we're all pioneers in our family, coming across the plains in the covered wagon and the wind wheels falling apart. And, I think about what their life was like. And, did they have dry eye? Maybe, possibly. They didn't have computers, contacts, medicines. They didn't live long enough either to really develop rip-roaring dry eye. So I do think it's in part a disease of modern living. Our diets are completely different than the hunting and gathering of the pioneers. I think the I think that just a quick segue. I think it's really interesting to dovetail into your heritage, and I think there's something to be said for eating what your heritage is evolved to thrive upon. For example, an Inuit Eskimo, really have no business eating rice and bulgur and grains, right?
Mm-hmm.
They evolved to thrive on meat and animal fat. So
Mm-hmm.
it's interesting to think about diet as a core component to what we do. Nutrition, I call that foundational, right? That
Mm-hmm.
FARM, which put in the pie hole matters. Pharmacy. And so I think about diet as part of it. I think our screen time is definitely an issue. Medications, age, contact lenses, the chemicals we're exposed to every single day. Pioneer women didn't have makeup,
No.
right? No, they they made soap from the tallows from the bacon grease and the ashes from the fire and whatever wildflower they could find to make it smell
Mm-hmm.
halfway decent. So it's just, I think there's a component of that as well. And then there's the masks, right? This is so interesting. I saw this really cool infrared video study of different types of masks and the airflow patterns that they generate. So the KN95s give a nice seal, but a surgical mask has a ton of blow by right up into the eyes, and you can feel it. Are you a dry eye sufferer, Dr.
Yes,
Kim?
I am. I am.
Me too. And I notice little changes, little disturbances of the force. I'm crying over, like, so I think mask wear is a part of it, even though it beats having an intubation tube down your
Yes,
trach.
yeah.
Like, so happy to put the mask on. Yep,
So me too. Yeah.
yes. But so I think it's super multifactorial. And then the DAO is another aspect of that busy, noisy, messy, disease state of dry eye.
Yeah, and that's what I want everybody to kind of take away, that it is multifactorial, and sometimes you have so many things stacked against you that's going to maybe catapult you into that dry eye disease state. And then there may be one instance at a certain point in your life that puts you there. I have dry eye, and I tell people it's chronic, and once you have it, you have it, but we learn how to manage it, especially if you are under the care of a dry eye specialist. But there was a point in time where I was taking oral contraceptives, and so my dry eye was really bad. And this was back in the maybe early 2000s, early 2000s. I was in optometry school, and we were, at that time, it was like, oh, just take tears. What's a dry eye? Take tears. It we didn't have a lot of research on treatment and treatment programs and diagnosing, but I just saw the pattern, how I couldn't wear contact lenses. Makeup was uncomfortable. There were times that I just wanted to rip my eyes out. And then Restasis came on the scene. And then, other topical drops came on the scene, and there were plugs. It was like we tried everything. And so now I love the space that we're in with dry eye, because now we can learn to really target. We're getting a lot of information about dry eye and some of the root causes of dry eye. So any dry eye sufferers out there, or someone that thinks they may be suffering from dry eye, this is definitely the time to get in with an eye care specialist and find out what the root cause is, so that way you can learn to manage like we both do. And so that when you're in situations that may exacerbate your state of dry eye, like wearing a mask, you'll kind of know what to do and how to handle any flare-ups. And so I want to dive into the DAO, because that's what made me just start stalking you after that lecture. And I've watched it so many times, and I'm like, this is amazing. We all kind of need to kind of know how all these things flow together. And like I said, you did it so well in your lecture. And so let's talk about the DAO. What does that novel term mean? And what can we do let's talk about what it means first, and then we'll talk about how we promote collaboration between everybody that's involved with this.
Super. Well, first of all, thank you. That's so nice of you to say. I'm glad that it means a lot that it's helping someone else and igniting their curiosity and interest to keep learning more, because that's really what it's about. Because I'm still learning too. So the DAO is a acronym for the dermatologic, that's the D, the aesthetic, that's the A, and the ophthalmologic aspects of beautiful, healthy eyes. So I call it the DAO. And it's really a mindset where you borrow from all these other specialties to better understand what's happening on ocular surface situation. So using the DAO as a construct, I took different concepts within each of those areas and show how they overlap when we're talking about healthy, beautiful eyes. So that's the essence of it. We can get into the weeds in a minute, but that's the overall view. I did this interesting thing where I'm such a visual learner, right? You can tell me something 100 times, but I got to see it through my eyeballs if I'm going to learn it.
Yeah.
It's so I chose a primary color for the DAO, derm, aesthetics, and ophtho, and then where they overlap, there was a secondary color. And then the background of the slides were according to
color. Yeah.
Yeah, just to show where all these things overlap. And the really interesting stuff is where they all overlap, like the Venn diagrams. And that's where the rubber meets the road as a clinician every single day.
And so for the dermatological aspect of it, what should, doctors know? What should consumers know? How does that play a role in potentially ocular surface or dry eye disease?
Sure. So the dermatologic aspect is wide and varied. I think as clinicians, we zero in on this little piece of real estate, but really it should be here, and really it should be all of it, right? So I think the temptation is to get up close and look with our slit lamp, but it's really important to take a look at what's happening in the neighborhood. You're going to look at a house to buy, you should probably check out the neighborhood a little bit. What's the shape of the schools, the roads, all these other, is there a library nearby, things like this. So by that I mean, is there evidence of rosacea? Rosacea is a very commonly overlooked component of our ocular surface disease, dry eye disease patients. And so learning to recognize those subtle little signs of rosacea can be very, very helpful. One thing that I've come to appreciate in the last couple of years is the role of seborrheic dermatitis. It's hard to diagnose, but it is a commonly overlooked component of meibomian gland dysfunction. Those oils are very dysfunctional in the sebderm situation. Patients can be a little bit their oils, they can be a little bit oily in their scalp, but it responds to a very inexpensive ketoconazole shampoo twice a week, ketoconazole cream to the face. IPL therapy can also be effective against seborrheic dermatitis, very effective with ocular rosacea and facial rosacea. It's in my hands, it's the fastest ticket to getting that ocular rosacea, facial rosacea, meibomian gland dysfunction, dry eye patient better the fastest. Before I had IPL, it would take me a couple of years. With a perfectly compliant patient, doing everything I asked to get it to turn around. And now I can turn it around in three months.
3 months. Yeah, and that's what I'm finding as well. And that's why I'm investing in IPL, because you have these patients who are super compliant, and we're seeing this evidence of the ocular rosacea, the tiny blood vessels on the lid margin. And so now that's why I'm investing, because I want to be able to get patients comfortable faster and give them the results that they're looking for. And so patients who are diagnosed with potentially rosacea, should they have a consultation with an eye care specialist, an optometrist, or ophthalmologist to see if there's a connection between the rosacea that they have and potentially some dry eye disease or ocular surface disease?
Well, that's a great question. And it's probably a spectrum, right? So you can start off as a facial rosacea patient, and you can start off as an ocular rosacea patient, but most become a hybrid at some point. So once you see one, you can be pretty sure that there's the other component there as well. It just takes time for it to fully manifest. So in my mind, when I have that dry patient that has some early facial rosacea, I'm offering them the IPL series. And you'll see this wonderful improvement in the meibomian gland expressibility. It's so satisfying to take somebody with toothpaste meibom, and after the IPL treatment series, getting that rush of clear, perfect olive oil.
Yes.
It's like I do a little yes inside. I just get really excited. This patient's going to feel so much better. So I love that challenge and that journey, and it's just a really fast way to help them get to that point. You asked another part of that question. It was very interesting. I lost it. That'll come to me again in a second.
Okay, yeah. And so, because it was about referral, and because patients may have. I'm sorry. Go ahead.
That's what it was. So I think as clinicians, if you are trained with your IPL machine, and you can learn to recognize these things and learn to offer the therapy. I don't think you have to go to the dermatologic consultation point of view, except for if you're just getting started in this arena and you're trying to develop your knowledge base and understand that thing, or somebody's not quite fitting the pattern, right? Or not quite fitting the improvement trajectory that you suspect. And so those can be masquerade syndromes such as lupus, right? So it's important to diagnose some of these dermatologic conditions and differentiate them.
Yes.
And if you're not sure, or it's like, something's just not quite fitting the normal pattern, go ahead and send them off for consultation. Absolutely.
Okay.
But be careful of things like lupus. There's a unusual subtype of rosacea called morbihans, and it's characterized by extreme ruddiness of the skin and a non-pitting edema to the skin.
Okay.
And for that, there's some special settings that I'll share with you later if you like.
Okay. And so in the other side of the spectrum, if you are a dermatologist, and should they consult with eye care specialists when they're treating patients with rosacea, or maybe taking creams for acne and things that can cause some ocular surface disease or meibomian gland dysfunction? I'm all about the most outcomes, or the most positive outcomes for patients, and kind of patients and clinicians getting used to working together, so that you don't have one thing happening over here and you may have something happening over here. Both people are not getting the results that they want, and it's like, oh, well, I didn't know you were being treated for this or treated for that. Did you know there's a connection? And so I guess a lot of what I'm doing now is, how do we help foster that collaboration between the patients in the middle and all the providers or clinicians that can help with their outcomes? What are your opinion on that?
Oh, wow. That's a great question. So I think there's multiple levels to that, and I wholeheartedly agree with you. The more we collaborate in all of our different subspecialties, the better the outcome for the patient. And that's something to cheer about and be, I'll leave my ego at the door. If I can, I'll wear a shingle if it'll make a patient feel better. Like I'll do whatever it takes. Let's get busy. Let's get you feeling better. So I think, reaching out to your colleagues, making introductions, like maybe stopping by with some cards. So nice to meet you. I'm just 2 miles down the road. I have a special interest in dry eye disease, and it commonly overlaps with rosacea. I'd be honored to be of service to help your patients with rosacea. The flip side is, the dermatologists typically have lasers for rosacea, something called a V-beam. There we go, V-beam. And that is a targeted specific laser, IPL, the broad spectrum beam of light. So it's a laser. So they might be able to up the ante on the power and the direction of the skin treatments as well. Plus their knowledge about the topicals is wonderful to glean as well. So I always write a really nice note. You know how in your EMR, when you go to send the note to a referral from somebody, I always preface it on the part that I know the doc's going to see, because EMRs go on for this. It's actually good for that. Really nice note. Lovely patient. Would love to have your expertise and opinion and management on this. Delighted to collaborate with you. Here's my personal cell phone number. I'll do, and I hope it makes a difference. But yeah, we have a lot of referrals in from dermatology, med spas, aesthetics, as well as fellow eye care providers, ophthalmology and optometry as well.
That's awesome. And so, good segue into aesthetics. So with your DAO, what specific things in aesthetics should we be concerned about or looking for in regards to dry eye, ocular surface disease? How do those kind of all fuse together?
Oh, there's some super interesting ideas on this. I'll start off with Botox. Botox, if done right, is a dry eye friend. Botox done wrong is a dry eye frenemy. So it's
frenemy.
So there's a technique for doing the injections, and I do these injections that helps to maximize the result for the dry eye patient. So this area, the glabellar frown, go ahead and freeze that up, right? You can put a teeny bit at the arch to give them a little bit of a brow lift so they don't end up hooded, right? And then you can freeze up that forehead if they're not, if there's not so much laxity that they end up snoopy eyes, right?
Yeah.
Here's where you avoid. Don't ever inject in the crow's feet. I tell my patients, like, this is how the world knows you're a nice person. Otherwise, freeze the rest of it up.
Okay.
But we need to see those little laugh lines so that we know that you're a friendly, approachable person. The reason is there's been wonderful peer-reviewed papers showing that when you inject into the crow's feet, that you actually impact the Schirmer scores, right, in an age-dependent fashion. So the older the patient, the greater the reduction in the Schirmer scores. It gets uptaken by the lacrimal gland, even though you're only putting a muscle, it gets uptaken there. Similarly, we now have some evidence that Botox placed in the V1 distribution, V3 distribution, actually gets uptaken by the trigeminal nerve and may have an impact in some of our more migraineur type dry eye patients, more of our trigeminal neuralgia type patients, the ones with significant pain component to their dry eye. So I'm offering that more often as well. And then lastly, this is a really cool trick. Filamentary keratitis is tough to treat, right? Came across this incredible paper by Gumus, Gumus, and Flugfelder, and the paper is about 6 years old. They took, 40 filamentary keratitis patients, and all they did is they put just a few units of Botox right at the superior, right above the lashes, just in the orbicularis muscle, right over the top of the orbicularis there. And 92% of them had total resolution in their filaments. And the thinking is that it's a friction problem. Just like a cheap, ugly Christmas sweater, right?
Yeah.
You rub on it starts to pill up. So if you reduce that friction, you're not going to get that pilling response. And so I'll use that for my SLK patients and my filamentary keratitis patients to really nice relief. That sandpaper that's like every time I blink, it feels like it's just scraping. They get excellent relief from just a teeny bit of Botox there. So it's borrowing, and I have to open the whole 50 units. I'm like, I got 40 units left. Let's use it. It's like, okay.
And so it was something you said really good. So listeners out there, so Andrea is on here. Lisa's joined in. Takeaway. One thing I took away is no Botox in the crow's feet area, because what that does, there's research has shown that takes up in the lacrimal gland, which is important, listeners, for producing the tears that need to mix with the meibum to make a nice tear film. And so that's going to affect how many tears you're producing. So that's going to exacerbate your dry eye disease. So when you're out there trying to look young and look good, make sure you go to someone who knows these things that won't exacerbate any dry eye that you currently have or put you at risk for dry eye. So those are important things to know. And so I didn't want to cut you off. Keep going. We're learning. But people are joining in and asking questions, and I just want to make sure that they get those key points there when they're trying to look good, the new you in the new year for 2021, that they don't come up with some dry eye or some tear production issues.
Right. And then we come to fillers, right? Fillers can look silly, or if done right, they can look really good. They can be used to help the dry eye patient. Sometimes, especially in the younger patients, sometimes that dry patient will have malar flattening, right? Where that cheek projection isn't as youthful as it was, and this mid-face is very flat. Well, the consequence of that is downward vectors on your lower lid. And that lower lid can't blink completely. And no amount of blinking exercises is going to help, because this is heavy compared to what that thin, round orbicularis muscle can do. There's only so much lifting it can do. It can't lift all of this. And so by supporting the midface, giving you a little bit of cheek back, you can take some of the weight and the work off of your orbicularis muscle, which is needed for a complete blink. If you think of when you hang a heavy painting on the wall, right? A single nail isn't going to do it. It's just going to come down. But if you have an L bracket on there, now it's stable. It's going to stay. And that's the similar change of vector forces that we're looking for when we're using fillers in the midface. You can use it to fill the tear troughs, and that can help change the lower lid position just like a quarter of a millimeter. And that can be enough to help with the complete blink and the evaporative losses of some patients.
Awesome. So you guys should take these take homes that you can use some of these toxins and fillers. They're going to have you more a youthful appearance, but at the same time, they can help with some of your current dry eye disease, ocular surface disease issues to give you relief and beauty at the same time. So beauty and science, that's the whole point of our show today. And so we have our listeners saying they're getting some great information. So I'm doing better by watching my questions. So if you have any questions for Dr. Laura, go ahead and put those in here so that we can make sure we get your questions answered so that you have a complete understanding of how you can look good but not cause any issues with your eyes. So I'm going to get to my next question here. And so we're closing out on the DAO. So we did the dermatology aspect, the aesthetic aspect, and now we're going to talk about the O. Tell us about the O, Dr. Laura.
The O, the ophthalmologic aspects, right? I'm talking about medications. I'm talking about things we put to adorn our eyes, things that we do to our eyes, contact lenses, refractive surgery, LASIK, PRK, cataract surgery, all these things. That's where the O comes in. I think in the very near future, and I'm so excited for this, we will have potentially up to 3 new eye drop strategies for addressing presbyopia. Yours truly is a poster child presbyopia.
I'm on the border. I'm there.
You look so much younger than I do. No fair.
I'm there. I have LASIK and I already have binocular issues, so I'm like.
I feel ya. Yeah, it's a bummer, but there's coming. I can see great for miles.
I know.
Oh, there you are. Hi.
But it's crazy because we're in the eye space, and even when it happens, I'm like, what is this? What's going on? Then I'm like, wait a minute. I know. I'm an eye doctor. This is presbyopia. Okay, just adjust your working distance. I can do this.
I think we need to wear capes.
I know.
To the rescue. That'll be fun. Oh, so that's where all of it meets, the rubber meets the road. And they, again, all these ideas overlap with each other. Ophthalmologic aspects, ophthalmologic consequences of the D and the A, such as Accutane for acne. Younger people, if you're listening, Accutane is brilliant for cystic acne, but there's a trend, and to your point earlier about collaborative discussions between the specialties, dermatology didn't believe us for the longest time when we said, there's an impact to the meibomian glands, you're snuffing out these precious oil glands. And they're like, no, what are you talking about? They're only dry for a couple months and they're fine. It's like 10 years down the road, we've got a train wreck on our hands, right? So finally, got those communications going, and now there's a trend towards much lower dose for a little bit longer period of time with Accutane. So I'm really excited to see if this is going to help down the road with the ophthalmologic complications of dermatologic treatments, right? I also encourage my acne patients to really focus on the internal stuff, the diet and the hormones and all those things, but also to consider dermatologic lasers instead of Accutane, if at all possible, because it just really trashes your meibomian glands. Chemotherapy can absolutely destroy your oil glands, and it breaks my heart every time I see somebody come in with really impressive dry eye, having had chemo, and it's hard to get them comfortable because there's not a lot left to work with. I don't give up. I roll up my sleeves and I get busy, but it's a much more difficult situation. The ophthalmologic stuff. So, and what we put around our face also very much matters. There's a common ingredient in skincare called argireline, and it's touted as being Botox in the jar. And that's not good when we're talking about the area around the eyes, and here's why. Low power mode. I think we'll get by for the rest of the session. Okay. Here's the problem with that. Your orbicularis muscle is this flat, thin muscle that goes actually just outside the orbital rim all around here, like a raccoon. It's about that sized, right? It has these teeny weeny little muscles around the neck of your meibomian glands that pump out a tiny bit of meibum every single time that you blink. Our sleep apnea patients that have floppy eyelid syndrome they suffer from nightly periods of low oxygenation, and that creates a smoldering inflammatory response that destroys those muscles of rheolon, and they can't deliver meibum. And then you get this floppy lid change, and now it's like having a hammock that's not pulled, stretched tight. You can't really sit in it or get anything out of it because it's not pulled tight the way it's supposed to be. So sleep apnea patients, I know you don't like your CPAP, but please use it. It adds 10 years onto your life. And actually there's some science showing, some peer-reviewed literature showing that it can slowly help reverse some of those laxity changes of your eyelids.
So takeaway, sleep apnea, that's a connection with dry eye disease. So make sure you're talking to your eye care specialist and use your CPAP machine. Lisa has a question. So Lisa wants to know, what's a great diet for a patient that has dry eye? What do you suggest for some things?
Perfect. Before I answer that, I definitely want to say, I want to add one more thing.
Oh,
with
definitely.
CPAP. There's this wonderful silicone vaulted sleeping mask from eyeeco.com, EYEECO.com. It's called iSeals 4.0, made for CPAP users, helps keep that turbulent air away from your eyes. It's fantastic for people that wake up with very dry feeling eyes, whether or not you use a CPAP machine. But hot tip, you have to wash it every morning with a very simple soap because bacteria and yeast love a warm, moist environment.
Yeah,
Has to be
I saw
washed.
you. Yeah.
Okay.
So you said that's iEco?
Eyeeco.com, iSeals
Okay.
4.0. Amazing. And you can even side sleep with it. It won't hurt. I'm a side sleeper. Let's see. So diet. Okay. So this is very interesting. It turns out that the diet is a huge component of it, and I'm a firm believer in omega fatty acid supplementation. There's 2 products on the market that have quality dry eye research behind them. There's other quality omegas, but none that have that hard scrabble, data-driven evidence in the dry eye patient. So there is only 2 that I recommend, and that's Hydro Eye, that's my personal favorite, and then also PRN Omega Health. Those are the 2 that are best for dry eye disease, according to science, right? But that quickly gets into a whole nother thing. Like you can go to the gym, you can like eat salads, but having a couple of giant cupcakes or a couple of giant Costco muffins, that's going to derail everything. So you can't do one thing and expect it all to work. You got to be consistent. And so then we get into the diet part. It turns out that rosacea patients have, this was published, just a couple years ago. They suffer from reduced gut microflora biodiversity. What does that mean? In your gut, there are more bacteria than there are stars in the Milky Way in each individual person's gut. I think that's amazing. You have a constellation in your GI system. I think that's incredible. Right? We're all heavenly bodies. We're all made of stars.
Heavenly bodies. I like that.
So with rosacea, there's a reduced biodiversity of the flora, and we think that results in loss of tolerance to foods. It's common for rosacea patients to have intolerance to wheat, dairy, soy. And so because of that, we find ourselves as a dry eye specialty clinic talking frequently about something called the Whole 30 diet with a W.
Okay.
Whole 30 diet, the Whole 30 diet. There's an online platform. You can sign up for the newsletters. It's brilliant. It is a brilliant way. You will never be hungry on the Whole 30 diet. Super important to point that out. No hungry. You might be cranky on day 3, but I'll get there.
Not hungry, but cranky. Take a nap.
Major crankosaurus, but it lives. So it's basically a reset for your body, for you to get in tune with your own body's reactions to certain foods. And you'll figure out who your true food friends are and who your food frenemies are. It's food as medicine, and it's absolutely powerful. I had this one 26-year-old man who looked like he was much older, right? Just wasn't taking care of himself, kind of bloated, a little bit of gray in the face, living hard, let's say that. And he came in with a one of the biggest Chalazions I've ever seen, right? This thing was like Rudolph. It was huge. Poor guy. And so I treated the Chalazion and looked down the hall, and my next patient was running late. So I went back in and I closed the door and I sat down beside him and I said, you know, you're a young man and I want to talk to you about something else I see today. I see someone who deserves to thrive, and I'd like to talk to you about one way that we can get there. And he looked at me and he's like, I've never had anybody take interest in me and my thriving. I'm like, well, I'm here, so let's get busy. And so I said, on the way home, I want you to stop by Whole Foods and pick up this book. This was before everything was online, right?
Mm-hmm.
He comes back 6 weeks later. I opened the door, didn't recognize the guy. Look at the chart. I see my note. I'm like, you're that guy. And he's like, yeah. He had lost 18 pounds. His skin was rosy. His beer bloat was gone. He had a twinkle in his eye. His meibomian glands were tons better. He said, what happened? And he said, Doc, I did what you said. And he said, you were right. I deserve to thrive. So I did exactly what you told me to do. My girlfriend did it too. And everything's going so well that we actually just got engaged.
Oh, wow. See?
So that's pretty cool. So he did the whole 30 and also the Hydra Eye, and I'm hoping he's still doing really, really great. Turn somebody's life around just by taking a moment to notice and partner with them and align with them.
That's important, especially, we joke and say the eyes are the windows to the soul, and you can tell a lot about someone's body by just looking at their eyes, their overall eye health. And I try to make that connection too in the exam room, where let's just take it past, your eyes. What can we do for your whole body, your life, and how can we make you an overall better person? And yes, I think we were separated at birth because I do those type of things in the exam room, and I think that helps you, garnish a relationship with your patient, and they know you care, you deeply care, and those things are important. Just like when you have teachers that deeply care, it's important to have your clinicians, your doctors, your eye doctors who deeply care about you as a person and want to see you thrive. So that's amazing. We've had a couple other questions here. And Andrea asks, does dry eye make it difficult for you to wear contact lenses?
Yes. My first intolerance to contacts was at age 28, right? When all this hit. And I was saying, oral contraceptives. I can't believe I'm about to admit this on camera, but I'm gonna be vulnerable and I'm gonna admit this. In medical school, it's really hard and really depressing. And I was on like a small dose of an antidepressant, and that definitely fueled the fire of my dry eye. I've been able to stay off it for years, but I did need some help during that in my life because it was really, really hard.
I'm sure a lot of people now in 2020 need some help. It's just, it's real.
It's a real thing.
Get the help when you need it. I think we've all needed help at some point, and and I appreciate your vulnerability, but that's helping someone else here. It's important to get the help. We're super women, but at the same time, we do need help. So.
That's right. Do need that bit of help. So I'm okay with my being honest and vulnerable about that. Absolutely. When you have dry eye, you don't have the tear volume or the components to float a contact lens comfortably on your ocular surface. You need an adequate tear aqueous volume, enough water basically, with all those corneal nutrition, awesome molecules that your native lacrimal gland makes. That's why artificial tears are temporary and not as good as your own native tears. Your eye doctors are always trying to help you make more of your own tears because there's like 1,500 molecules of corneal nutrition awesome sauce in lacrimal fluid. And the artificial tears can't come close to that. So we're always after your own tears. Then the poor goblet cells get boxed. These goblet cells, they're like Clark Kent for the ocular surface. They're just like these silent heroes, and they're putting out enemies left and right. But when there's enough kryptonite around, Superman can't do his job.
Do anything,
Yeah. And so your eye doctor is always thinking about, well, how can I restore this person's goblet cell density so that they have enough mucin to wet and spread that tear film beautifully, to float that contact lens with less friction, to to calm any kind of inflammation or Lex Luthors that are coming to a head, right? We need these superheroes on the ocular surface. That's why goblet cells are so important. And then your meibum to protect all of it from evaporating.
Definitely. And so I was trying to make sure I caught all of our questions. People are really enjoying you asking good questions, and so I'm trying to answer some of them during your speaking. I want to shift gears a little bit too. We have a little time left, and this is important. You touched on a little bit about maybe 10 minutes ago about cosmetics and skincare. So let's talk about cosmetics, skincare, and how those things can potentially affect ocular surface disease and dry eye. And what should listeners know?
Right. So I think key takeaway for listeners is what's good for your skin isn't necessarily good for your eyes. A prime example of that is on our intake questionnaire for every new dry patient, we ask what they clean their face with. And I'm shocked at how often it's something like Cetaphil. Now that's a problem because even though it's dermatologist recommended, it's probably the top drugstore brand out there. It overstrips that delicate meibum that those poor little meibomian glands are slaving away to create to protect your precorneal tear film. Just like when you wash your hands too much, you strip your oils and then it gets really dry and cracky and flaky and rough. Same thing happens with our eyelids. Yeah, exactly. Oil and washing, and yes, exactly. My cuticles are a mess.
Oh God, yeah. I get them done and I'm like, why? Why do I waste my time?
It's the temporary feel good. You got to have a little bit of that.
Yeah, you're right.
Anyway, so don't overstrip your oils, right? This is, I call this an SFZ and a BFZ, a soap-free zone and a Botox-free zone, right?
Okay.
Yeah, otherwise fire away. So keep your foaming surfactant face washes away from the area.
Right here.
Your anti-aging creams, nothing with retin-A. That's prescription grade. You'll see retinols in some of the over-the-counter beauty products, and that there's some cell culture evidence that those are pretty hard on the meibomian gland stem cells. So be aware of the retinols. Honestly, I tell my female patients, save your money, and my male patients too. They want to look good too. Like everybody thinks it's just a ladies' game. They want to look good too. They're like in it to win it too.
Yes, definitely.
Anyway, so it's like, save your money for some dermatologic lasers. Like, let's see how far we can get with your IPL series, because turns out there's an aesthetic benefit. It's a side effect that most people don't complain about too much, of looking better. And it's so there's ways to get around that without exacerbating the problem. The makeup, the way we remove our makeup is very important. The number one makeup remover in the U.S. is that Lancome Bifacil, that blue bottle stuff. Oh gosh, that stuff is so full of ocular surface unfriendly ingredients. It's not even funny. So I've tried for years to teach about ingredients to avoid, and it's hard because when you read the back of a cosmetic product, it's like a foreign language. I've gotten my sweet revenge on organic chemistry, that's for sure. So I've learned how to read these labels really quickly and spot the offending ingredients. But at this point, there's not a brand that I feel safe recommending. That's a high bar as a dry eye specialist. But the main takeaways are, don't overstrip those precious oils, right? Watch out for the preservatives in common cosmetics, and there's really 6 you really need to watch out for. The first 2 are easy. They're ureas. There's sulfonylurea and I forgot the name of the other urea. There's 2 ureas. There's one called DM hydantoin. I call that the dum-dum molecule. Those are formaldehyde donors, right? You need to watch out for quaternium 15. And you also need to watch out for something called hydroxymethylglycinate. Hydroxymethylglycinate is a formaldehyde donor in the presence of water. So if you have a water-free solution or a water-free product, it may say formaldehyde-free, but the instant it comes in contact with water, those electrons rearrange and formaldehyde's liberated. That's why it's an effective preservative. But formaldehyde is very hard on the corneal nerves and is thought to help exacerbate dry eye disease. So learning how to watch for these little sneaky things in your skincare. And I think people are, you know, much more aware than they used to be. And as eye care providers, I think it's up to us to help curate and come up with lists of things that we feel like, okay, this is not perfect, but it's better than what the other things are, what you're currently using.
Yeah, and I think that's important. Like you said, that Lancome, every time I ask women what they're using to remove their eyes, it's like that's what everybody's like using. And so I think it's just having these conversations is important. You know, even like myself, you know, I'm learning. I'm like, I was in the store today. I'm like, okay, oh yeah, I can't get this. Or, you know, so with that being said, with there's so many products that have these things in them that, you know, it's going to be hard to avoid. You know, in reality, you know, we're going to look good. We're going to wear our makeup. So what should patients do? You know, is it moderation? Is it, if you're going to wear that, is it important to, you know, what do you use to remove it? So what is your suggestion? Of course, we have a list, but until we get that, you know, that change that mindset that these things do matter. You should really look at the ingredients on the back of your cosmetics and skincare, just like you do your foods. What do we do in the interim?
Oh, that's a great question. I struggle to answer that, and I'm not trying to be obsequious. I don't want to say something and have somebody go out there and grab it. And
you know, okay.
Because here's the thing, like cosmetics companies can change their formulation on the dime and not tell you. So you could say, let's say you have a patient with dermatitis comes in and they're allergic to nickel. Well, nickel is a common ingredient in some of the eyeliners. You find one that's nickel free, but then they change their formula and your patient comes in with this rip roaring dermatitis and you're like, what happened? Right? So it's really hard to recommend brands. I will say that there's a couple of Canadian companies that are doing a really good job with the mindful clean beauty. There's one called Ilia and another one called Omiana that I really like. There's a skincare store in LA that I really like called the Detox Market. And if you call them up and say, I need a moisturizer that's free of all the stuff on Dr. Perryman's no-go list, they'll say, okay, are you oily, are you dry? Or they'll match the ingredients you're avoiding with the performance that you're looking for. So that's another source. And I'm hoping to create more collaboration with things like that so I can, because I can't keep track of all the products that are out there.
It's hard. I agree.
I do keep track of the scientific literature that's describing the harmful effects, like that I can do. And then
having a resource for patients, that's definitely a good feeling for you and as us. We can say, well, go here, and we know, nothing's perfect, but this is a good starting point. Yeah. So the whole key is just not to exacerbate anything. So that was, you said that was a detox, the
Detox Market.
Detox Market.
Yeah, they do a really good job.
And we have another question here. I'm trying to think if I understand. It says, are there any vitamins we should watch out for? So, Andrea, do you mean vitamins that you should take if you have dry eye, or is there any vitamins that may potentially exacerbate dry
eye? So while they're writing back, I'll take a shot at that question. Awesome question, by the way. So it turns out that vitamins and antioxidants and trace minerals are very important for the dry eye patient, but people commonly overdo it. Yeah. I've seen cases of brittle eyelashes and horrible dry eye, and I'm like, let's check your vitamin and mineral levels, and their selenium was 100-fold higher than it should have been. I'm like, oh, that's the culprit. Let's back off on the selenium. So you can absolutely overdo it with the supplementation. But as far as like baseline, just a simple whole food based multivitamin mineral supplement, just pick something like from Pharmaca or Whole Foods or places like that, and it doesn't have to be 100% on everything, because you're eating quality food all day long.
Yes.
So you're still getting all those other sources. You just need a little bit of support, right? And your things like Hydro Eye have some of the cofactors and trace minerals and antioxidants in it as well. Speaking of antioxidants, I also recommend vitamin D for my dry patients, because vitamin D has such a pivotal role in immunoregulation, right? What was I going to say about that? I forgot. Sorry.
Oh, so she
I lose my
said,
train of thought all the
I think
time.
she answered it. She said, what should she avoid due to dry eyes? So we talked about not overdoing selenium.
Yeah.
That's one major one.
Vitamin B12 is the other one to watch out for. So it's really common to receive vitamin B12 injections for energy. Caution. There are peer-reviewed literature reports of fulminant, which means rapid onset and severe, is what fulminant means, meibomian gland dysfunction in response to vitamin B12 injections. So it's frustrating for a patient. They're like, well, what do I do, right? It's like, I'm damned if I do and damned if I don't. It's like, well, join the club.
Basically.
It's hard. Yeah, it's like, is moderation, and Americans aren't exactly pros at moderating anything. We go all out.
Yeah, go hard or go home. That's what we do. But yeah, but that's important, moderation, because if you sit there and stress, you'll put yourself in a whole nother level of stress just trying to figure out what to avoid because you don't want to, set off your dry eye or meibomian gland dysfunction. And that's kind of what I want to get at, moderation. That's just with anything. When you're dieting, you get so strict that you fall off the wagon and then you gain all the weight back. So you have to learn these small lifestyle modifications and how to do things in moderation and give yourself, an okay or a pass if you do something like, I'm not a fan of like strip lashes. There are other alternatives than putting that adhesion on there, but if you do it, it's not the end of the world. Don't make it a habit, things in moderation. And I think that's important to kind of take away because I don't want anybody leaving stressed. We had enough stress in 2020. We're trying to look good. We're trying to look good and make sure that we minimize any complications with dry eyes as much as we can. And so I have one other question. I'm really enjoying you, but I know people want to get back to the rest of their Sunday. And so basically to shift gears here, where can people follow you? Where are you on social media? So that way if they want to follow you, get more information. And where do you currently practice? I know you said you're in Seattle. What's the name of your practice? We may have some listeners who are out on the West Coast. Where can they find you?
Oh, awesome. Thank you so much for that. So you can find me, my website is www.dryeyemaster.com. You can schedule telemedicine appointments there, regular appointments there. I've got loads. I have a patient gallery of before and afters. Go enjoy. Videos, articles I've written, my scientific publications are there. You can follow me on Instagram at dryeyemaster, and I try to keep it light and fun. Some good cases in there, some good pearls too, but also an occasional, like I'm not afraid to poke fun at myself, so that's fine. Facebook, I'm Laura M. Perryman, MD, is my professional page.
Uh-oh, did we lose you?
Are you still there?
You're still there. I think we're losing you. I know your battery's dying.
There we go. My husband tried to call. He has impeccably bad timing of when he tries to call me.
And then if you hang up, he'll just keep calling. I'm like, I'm doing my show. Then he's like, oh.
Oh, goodness. The sound warned me that it was going to do this.
Oh, well, it looks like we lost her. I don't know if her battery finally died, but you guys, thanks for joining me. We've gone over 8 o'clock. I usually try to like to keep it in 45 minutes or so. Oh, someone says they love her. I definitely want to make sure I get this to her, but you all, thank you for joining me. I believe we may have lost her permanently because I know her phone was dying. But yes, thank you for tuning in. I'm Dr. Janelle OD, your eye care expert, and I try to help you connect the dots between beauty and science. Here she is. Okay, you're back. You're getting so much content. Someone said that they love you. Someone said this is a great discussion. You just changed Jennifer's life. And I didn't want you to miss all this love that you're getting. Everybody said they enjoyed the session tonight. So you are by far one of my rock star guests that we've had on here today. We've all learned so much. Oh, yeah, we got a toast. So I didn't have bubbly, so I have nice Chardonnay. So if you have a glass of anything, bubbly water, tea, what have you, you're going to grab your glass and you're going to hold it up and we're going to toast to 2020, turning tribulations into triumphs. 2020 was very trying for most of us. I would say pretty much all of us. We have maybe have lost some loved ones. We may have lost jobs. Practices have changed, but we are finding the silver lining. And on top of all of that, we still have blessings. And so we're here today, and we're excited to be here with Dr. Lori Perryman. We appreciate her time, and toast up your glass to a happy 2020. And now we're ready for 2021. Cheers.
Cheers to you, Doc.
And like I said, I appreciate you being here. It's a 3-hour time difference, but our listeners today really enjoyed you just like I did. I knew you guys would. I enjoy her lecture. Her lectures are fun. She puts music in her lectures, and I was looking at your lecture at like 10 o'clock at night. And I said, anybody that does that, I've got to know them, because she seems like a very genuine person and very knowledgeable. And so our guests have really learned some things today, and they tuned in. And so hopefully we can touch base with you again sometime in 2021. And I wish you a great, happy holiday season. And so listeners, we'll be back sometime in January. Stay tuned. I'm in the process of trying to make these into podcasts. But, busy mom, doctorpreneur, mompreneur. So stay tuned and see what's next. And you guys enjoy the rest of your Sunday.
Thank you so much.
Bye.
Bye.